0 students.
Oh yeah.
Meaning not all, but
Journalism students.
there were a lot from colleges, yeah. Overachiever kids, I mean, amazing.
Yeah, cool. Welcome back. You're listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And I'm Dr. Christopher Jackson, PhD, DOM, Florida. And I've been tossing around some ideas on today's show and decided we'd talk about a subject, although we've alluded to some other topics previously. I want to focus on some of the differences in approaches between conventional medicine and natural medicine, and then also talk a little bit about integrative medicine. So these are all topics you may be familiar with, you probably are. And I know that a lot of our listening audience is already into holistic medicine, natural approaches, that kind of thing, but has also experienced the conventional medicine route. And so I want to kind of explore the differences and the reasoning behind and so on. You know, I mean, in my background, and I've done board certifications, board testing in both areas, in biomedicine as well as natural medicine, oriental medicine, and so on. And I have obviously some background in both areas. So I wanted to kind of differentiate between the approaches and explore how the differences make a difference. Okay. So, for example, we can start up by addressing a specific disorder. Okay. Say we look at somebody who comes in with into the ER with palpitations. All right. So somebody comes into the ER with palpitations. What does that mean? They're having fluttering in their chest, you know, maybe an irregular heartbeat. And the assumption is maybe there's a cardiovascular issue or a heart issue going on that may be needing to be addressed, maybe an emergency condition. Okay, so they go into the ER, and the first thing they do is they test their heart. Put them on an EKG, check that out, you know, listen to their heart, listen for any irregularities, and so on. Treat it as an emergency condition. Quite often, in these situations, the individual is cleared. They've got a good EKG. They might also do an echo, you know, echocardiogram, just to look at heart function physically, you know, how it's pumping, what ejection fraction there is. In other words, how much blood is being pumped out of the heart, how much volume is being pumped, and how well, and look at the functionality of the valves inside the heart. And they may see that things are normal. In some cases, they'll find maybe an issue with one of the valves or one of the chambers or wall thickness, things like this. But very much of the time, when somebody goes into an ER with palpitations on a regular basis, it turns out their EKG is clear, they're considered fine and sent home. Mm-hmm. Okay? Does that mean that they are fine, that they're well? Not necessarily. Probably there's something going on, right? You don't just arbitrarily have these things happen. There's a reason for them. Okay, so the difference is the approach that I would take is to look for the reason, not to assume right up front that it's got to be a heart condition, and then explore that heart condition, and then see, oh, okay, not a heart condition, see ya. Okay, so why does that happen in conventional medicine? Well, first of all, the most problematic situation, basically, the most urgent situation, would be a condition of the heart, right? I mean, unless it was something that would be typically unrelated to palpitations, like a stroke or something like that. But most likely, it's going to be an urgent condition if it is a condition of the heart. So of course they're going to start with exploring that and examining that. And it does make sense to do that because the life is at risk if there is a problem with the heart. And after all, we're talking about an ER here, right? We're talking about an emergency room, a situation where somebody's gone into the ER to address their issue. So everybody in the ER is geared toward treating emergency conditions. So that's the focus. Now, where the problem lies, there's several areas, but one of the situations, and we'll explore this a little bit more, is that much, if not the majority, of conventional medicine is geared around emergency medicine. So that what we have is when general practitioners or when even specialists are addressing health conditions from the perspective of conventional medicine, they're addressing them with the efforts being geared around treating an emergency condition, even if they're not treating an emergency condition. So they're using the same drugs in some cases as they would in an emergency. And often the drugs that are being used cause their own health effects, which has, from a marketing point of view, been labeled side effects to diminish their importance, right? Side effects. They're just side effects. But actually, they're direct effects of taking the drugs. Okay, that's one aspect of it. Now, when the individual is sent home from the ER, in some cases, they may come see Dr. Jackson. Okay. In some of those cases, I have seen people who have gone to the ER with palpitations, having this condition that they're afraid that they're having a heart attack, or they're concerned that their heart's not working correctly. They get checked out at the ER. The ER says you're fine, but they know they're not fine. So they come see Dr. Jackson. Okay. So the approach that we take is to go through an intake and go through all of the possible physiological, or all of the likely anyway, physiological conditions that could be related to the condition they've experienced or are currently experiencing. Okay? And this is the approach of holistic medicine. Holistically, we're looking at the whole person. So we're looking at mind, body, spirit. We're looking at the person from their physical body to what's going on with the outside influences, to their environment, and to their social as well as physical environment. So we're talking about things in their environment as in chemicals or electricity or things like that that could affect them, but also their family dynamics, things like this.
I'm sorry to interrupt. Would you say that a lot of our physiological issues are created by psychological situations, or?
Well, as I've quoted before, the AMA, and here I am quoting the AMA, said years and years ago that 80 to 85% of all disease is caused. They actually use the word caused by stress.
Mm-hmm.
So in answer to your question, yes, a lot of the disorders are influenced by the mind and influenced by situations in that person's life that may be causing undue stress or things like that. And that's where, physiological medicine just focused on really the physiology and the mechanics of the body without looking at the psychosocial aspects that comes into play.
I have one more question, which is a little not off the track, but it takes it to the next step in the sense that okay, so now I'm really stressed out, etc. But today I heard on the program on TV that somebody said, I'm bloated, and my doctor told me that when I'm bloated, it means my adrenals are depleted or low.
Mm-hmm.
Do the adrenals get directly affected by stress? I'm even getting confused on what the adrenals are.
Okay, the adrenals are these walnut-sized glands on top of your kidneys. Okay.
Oh.
That's right. And what they do is they respond. There's a lot of functions, okay, but they respond to stress physiologically, So there are specific hormones created. There are specific hormones created that are called catecholamines. And then there are other metabolites from those catecholamines that are derived as well that go into the bloodstream. So there are a lot of these hormones that are created via the adrenal function. Adrenal function affects you in the morning and affects you at night. If you are stressed by something going on during your day or during your week, it makes it more difficult to get to sleep at night because your cortisol levels are elevated at night, and that can keep you awake, or it can make your sleep rather short. If you find yourself waking up in the middle of the night, like at 3 o'clock in the morning, you're wide awake. You just wake up in the middle of your sleep and all of a sudden you're wide awake and you can't get back to sleep. That quite often is adrenally induced because of stressors in your life. Another aspect of it is the influence on epinephrine, norepinephrine, and dopamine production that affect your waking state in the morning. So these hormones affect you by helping you get up and go, get you up in the morning and get you started with your day. So they're important for that reason in the morning. But at night they can get in the way. They can actually interrupt your sleep. And then that makes your next morning pretty rough, this kind of thing.
Mm.
Did I answer your question, Anne Marie?
Yes, absolutely.
Okay.
And the thought comes because you're talking about mind, body, soul, and there's a tendency, we always think of, I shouldn't say we, because that sounds like a lot of people, but I'll speak for myself. When I think of mind, body, soul, a lot of yoga comes to mind, meditation, and all the other things,
Right.
And we have a tendency to forget that when we talk about mind, body, soul, it's not only on a spiritual level or there's a tangible there that happens based on not having unified, mind, body, and soul. And that's
Right.
where you come in.
Yeah, I tried to help with all of that at one time. Yeah, that's true.
So when somebody comes in, I'm sorry, I wanted to.
But the point is there that mindfulness is very important in all of this, in dealing with the stressors that we have in our lives. We have large stressors in Western society, and especially in the United States, where, frankly, people aren't really well taken care of with the investment in taxes that we make. There's not a lot we're getting back compared to other countries, honestly. So, you know, it's a bit more of a struggle this way. I mean, yes, you know, we can put lots of money into the military and defend our country, and that's certainly important. But it's also problematic that that money isn't going into social programs that help. I'm not saying from the point of view of just helping people who are down and out, but from the point of view of taking care of all of the situations that we have in our society, and that including issues like the mentally ill who are often put on the streets because there's nowhere for them to go. And then we end up with some influence from that on crimes and these kinds of things, you know. So anyway, I'm getting off track here a little bit, but all of this does affect us. And there's a kind of an underlying thing. In fact, last time we did the show, you and I got, Emery and I, producer, got in to a little conversation. We were talking about how people's minds were being affected by 9/11 and just the anniversary of 9/11 and going back there and seeing reruns on TV of that situation, you know, this kind of thing brings people down, and it kind of, it may be riding in the back of your mind somewhere. You know, you're not really thinking about it, but it's there and it's on your mind while you're going through your day, and it can affect your decisions. You know, it can affect how you feel throughout the day, throughout the week. So, you know, and the more we hear about situations out there, you know, where there's violence, you know, the more that kind of brings that back. So it's a sort of maybe PTSD, kind of a, I guess we could call it a collective PTSD, kind of like the collective unconscious of Carl Jung. It's kind of a collective PTSD. You know, we are as a nation traumatized by the events of 9/11. And so the people within our population within the United States, and there are similar events all throughout the world. I mean, there have been bombings throughout the world. You know, there have been mass population attacks. You know, certainly in Britain and France. You know, look at, you know, what's going on in Syria as well, but Turkey and many areas of the world have been experiencing these things. And then that kind of takes me on another path in thought, but I'm really veering. But it really is part of this picture. Look what's happening with our society over time as kids turn into adults, coming from playing video games day in, day out. And the video games gradually become their lives. Their lives are going home and playing their video games from school, right? And what kind of mental training does that do to a young mind? How are they being affected by that? How are they being affected by, in some cases, in a lot of these cases, being at war every day? You say, well, it's not real. Well, yeah, it's not real. But, you know, mindfulness is somewhat about being centered, being focused, being aware. But there's a kind of distorted awareness that comes from playing war games on a video game day in, day out, to where the sensitivities are changed, to where the brain is changed. I say is because there are studies, there is research in this area backing up what I'm saying again. Okay, so there are changes going on here, and how does that affect us? Where is the mind, body, spirit aspect of our beings going? How is this being changed by these kinds of things? So we have the real life, real world events of, Al Qaeda and ISIS and these kinds of things and their terrorism. And yet we are okay with our kids going back and being at home on their video games, playing war games, killing people day in, day out. And a lot of these war games are pretty gory. So they're experiencing these conditions of war as a child. 18-year-old kids can't even, they're called men when they go into the army, right? 18-year-old kids. But they're kids, but they're legally adult to some extent, right? And, we're allowing them to go to war, which is something, a whole other topic. But, they can barely handle it. And yet we're allowing these children to be wrapped up in war games day in, day out. It may not be real, but when you are there, when you're in the zone, so to speak, and you're actually in that game and experiencing it, it's like being there in a lot of ways. And your mind, it goes there. And back to the adrenal function's affected. You're getting more stress hormones being created there. Then how's that affecting them? Those are steroids. Those are steroids that are being generated while that young mind is being exposed to war. Okay, anyway, that was our political announcement for the day. And I think I'll take a little break and then we'll come back and talk more about some of these examples and differentiations in the approaches. So this is about the whole you. You're listening to A Path to Wellness on rhinoanair.com, WSPF-DB.com.
the bounce back.
So you know about it.
And I already sent you a message.
And we're back. You're listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And so we're exploring some of the difference in perspective and approach between, and I know that saying between this and that is like we're putting them at odds. That's not my intention, but there are differences in the approaches, obviously, between conventional medicine and holistic medicine. And up until recently, conventional medicine has tended to have kind of a philosophy in general within the system, and kind of somewhat surreptitiously attempting to marginalize or to even ignore or minimize natural medicine and holistic medicine. But I think the awareness is growing that really most likely the best approach is to integrate the two, to bring us together, to share, to partner, to join together to create a better result for the patient. And that's what it's supposed to be all about, right? It is to help individuals be healthy and to find ways of addressing health conditions when they arise, and to make us whole. Let's put it that way. So if it's about making us whole, about bringing back balance and making us well when we encounter these situations in our lives, then we've got to take another look at working together. You know, and for too long in the United States, at least, medical care has been about sick care. It hasn't been health care. It has been sick care. Treating the ill, treating sickness, treating an individual who has an illness by addressing that illness and being done. And addressing it in what way? Symptomatically, typically. Meaning treating the symptoms, but not really getting to the root cause in a lot of cases. Okay. And particularly when it comes to chronic disorders, this has been really problematic. And this is part of why a lot of people are seeking an alternative. Okay, because the focus on treating the symptoms can often ignore the fact that the cause is still present. So, okay, let's use another example. For example, headaches, and this is a little bit difficult to describe, but let's use headaches. Okay. Now, in conventional approach, headaches, what do you do conventionally? Right? You pop your pain meds, right?
I use lavender.
Okay. So Anne Marie uses lavender.
Oil.
Okay. Lavender has calming effects for sure. So maybe that helps in her situation because her headaches are from tension. So it calms her tension. It calms and relaxes her, and therefore the headaches go away, for example, right? But generally speaking, the approach is pain meds. And if somebody has really chronic, regular headaches, then they might be set up for a CT. Okay, and maybe later on for an MRI, depending. But basically a brain scan, look at the, what's going on in there, and that kind of thing. And if nothing's found, then okay, well, take some aspirin, or take some Tylenol, whatever. Okay, that's a simple headache, right? Then we have migraines, different situations somewhat, but similar in the sense that pain is what's focused on, treating the symptom. But what about the root cause? Okay, so that CT might be, one of the things they might be searching for is a brain tumor, right? Because brain tumors can cause headaches. And that can be one of the first signs of a brain tumor is the headaches. But that doesn't mean if you have headaches, you have a brain tumor. Okay.
I know, right? It's not a tumor.
Okay. So where do we go with that? Well, okay, holistically, what I would do is try and figure, okay, where are these headaches coming from? And actually, we kind of alluded to that when Anne-Marie mentioned that she used lavender when she had a headache. Okay, I alluded to the fact that, or to the theory at least, that they may be tension headaches. And we can figure that out, but they may be tension headaches. And the lavender may be helping her because it calms her tension, right? It relaxes her. Therefore, helps those headaches go away because it helps by treating the root cause, which is tension, stress, right? Okay. There are other reasons, many, many reasons for headaches. And, not one of them is a Tylenol deficiency. Not one of them is an Advil deficiency. Or even an aspirin deficiency. So, in other words, the treatment is a drug to treat pain. It's addressing pain receptors, these kinds of things. The chemical process, COX-2 inhibitors, these kinds of things that are involved in the process that leads to pain and inflammation. Chemical messengers, these kinds of things. Well, yeah, actually, they don't even get to that too much, but there are approaches that do get to that level. Inflammatory cytokines are what I'm talking about, just they're chemical messengers that are involved there. But overall, or more big picture, one of the things that may be influencing production of headaches may be the influence of, in a woman, hormonal imbalance. Hormones can affect mineral levels, okay, in the body. And the mineral levels then affect blood flow. And then when the blood flow is affected, that can create headaches, and it's blood flow in the head and brain. So by rebalancing or improving the hormonal balance, the headaches may eventually go away. And I see this clinically regularly because, when I treat these conditions, I'm not just treating the one condition typically. Most patients I deal with are experiencing multiple conditions. And so what I do is I use those multiple conditions to uh, to triangle, you could say, or to navigate me through the condition. So in other words, there may be multiple situations, multiple symptoms that are pointing to a single or a couple of causes. So I use them to guide me to the underlying causes. And so when I'm doing an intake, I will ask some initial questions. I will start to delve into what the chief complaints may be and ask about other situations that could be related to those chief complaints. And then, depending on the answers that I get from those particular possibly related conditions, then I'd start tying all of them together and look for or try to tie together underlying causes or potential causes. And then I may go into standard diagnostic testing, just like you would experience in a conventional office. But there again, my approach is not the same because I don't, there are a lot of things going on in conventional medicine that I feel are done because of insurance or because of liability instead of for medical reasons. And there is a philosophy of minimalization of testing. There are some positive reasons to that, but there are also some problems with that because there's a tendency to make a leap and draw inferences instead of look directly at the data. And inferential logic only works to a certain extent. There's a limit to it. There's a limit to what you can infer from a few pieces of data. But if the data are directly looking at what and looking at possible causes, and then you can see from the data where those specific data points are abnormal, you found the cause. You see, so a lot of inference is used in the approach in conventional medicine. I'm being kind of vague. I've often given the example of TSH. TSH is one of these types of things. Thyroid stimulating hormone or thyrotropin stimulating hormone, the thyroid stimulating hormone, TSH, is conventionally used by, very, very high percentage of conventional docs as a screen for thyroid disorders. Unfortunately, it's very, very erroneous much of the time because it's not directly correlated to thyroid function. It used to be thought that it was, and the logic kind of went along with that, and therefore to minimize testing, you just test TSH. And so the inference is made that if TSH is high, in other words, the stimulation of the thyroid is high, then the thyroid must be low functioning. Or if the stimulation of the thyroid is low, the thyroid must be high functioning. Or if it's too high, then the thyroid is too low, and the opposite. So it makes some logical sense, however, it doesn't bear out in fact. And the research for the last few years has been backing this up. The research is bearing out that TSH is not directly related to thyroid function. It stimulates thyroid function. It stimulates the thyroid. But the actual thyroid function can be determined directly to really see what it's doing, as opposed to using TSH to infer what's going on with the thyroid. This is the difference. The same is true with hemoglobin and iron. I found this to be the case several times, where an individual had hemoglobin that was fine, great. In fact, I had one who was being told that she should go ahead and donate blood, because she wanted to donate blood. She was being told, that's fine, go ahead. Regularly, like every few months, she would have her visit and they'd say, fine, keep donating blood, Well, what was happening was they were only measuring hemoglobin and not looking directly at her iron level. So, turns out she was anemic at dangerous levels. She had so little iron in her blood, she literally could die. But her hemoglobin looked fine. So you see, inference it works part of the time for that narrow population that everything's in line, but there are a lot of individuals who slip through the cracks because the parameters aren't being tested directly, they're being tested indirectly, or in other words, they're being tested by inferential means instead of direct means. And I've seen the opposite end of that situation as well. I've mentioned this before, but similarly, in some ways, hemoglobin being tested, right? Hemoglobin being tested. Had another individual recently that hemoglobin looked fine. Had been tested regularly, and the hemoglobin was looking fine, and they were told they were fine, and nobody looked at iron. But they had these complaints, they had these issues with joint pain and other things going on that were kind of, an issue in the background. And of course, those were being dealt with pain meds and this kind of stuff. And liver function a little bit was being challenged and this kind of stuff. And hemoglobin was being tested, and hemoglobin was fine. So the idea there is, iron must be fine. But when we tested the iron levels directly, turns out we had a situation that now appears to be a genetic situation, in other words, family situation of hemochromatosis in this case. Hemochromatosis can be classified in different classifications. One of those is a genetic version of it, and then there's simply a condition that's been created somehow, like through diet that is extremely high in iron or these kinds of things. But so that situation with that individual was that their iron was too high. And what was happening was the iron was getting into their tissues, getting into their organs at levels that were interfering with the functionality of those organs. And these problems were starting to arise. And these kinds of situations occur where the individual may appear similar to a diabetic, may appear similar to somebody with osteoarthritis, may appear even similar to somebody with hepatitis and simply be extremely high in iron. But if all anyone is measuring is hemoglobin, quite often they're not going to be found. That hemoglobin may still be in the normal range, even though the iron levels are extremely high or extremely low. But again, this is the conventional approach. To simply test hemoglobin and by inference say, okay, you're fine. Missing these situations. So you see the testing that I do, although I do the same testing, I also do, the regular CBC and CMP or complete metabolic panel and complete blood count and platelets differential type testing. I don't just stop there. I'm looking deeper. So in a lot of ways, I think that conventional medicine has had this mindset that what we do, what holistic practitioners do, is minimalistic, or it's actually more the opposite. Conventional approaches tend to be more minimalistic. And holistic medicine looks at more of the factors that may be involved physiologically and in terms of the psychology of the individual as well. So it's mind, body, spirit. It has to do with that whole person, which is where holistic comes from, right? The whole person. So as you can tell, we've alluded to during this show several other factors, such as stressors in our lives that affected renal function, which was a great question earlier. And then that affects other situations. Like, I'll give you one more example of that sort of situation. So stressors, say somebody manifests with type 2 diabetes. They test out as type 2 diabetic. Yet their diet has been pristine. They have been eating green leafy vegetables as much of their diet, fruit, some fruit, avoiding high sugar content foods, staying away from candies and white bread and even starches in general, and they're really having a clean diet, and they have some good fats, avocado and things like this, olive oil, non-cooked, by the way, but they're having a good clean diet, and yet they test as diabetic. And it's not type 1 diabetic. This is a different kind, type 2. Where it is influenced by the individual's diet. And what's happened is over time, typically, they have consumed foods that have set off track kind of their cyclical blood sugar regulation. And what's happened is over time, they have developed insulin resistance. And the insulin resistance has grown to the point that they have been classified as diabetic. So if you're having a beautiful diet, great diet, very healthy diet, you've done that all your life, how the heck can you end up with diabetes? Type 2, I mean. And that ignores the influence of stress. See, if that individual has been under stressful conditions a lot, what's happened there is the adrenal functions kicked in, cortisol levels have been increased anytime they've had these situations, fight or flight type situations, and they've been secreting all of these glucocorticoids that raise their blood sugar. The blood sugar spikes, insulin spikes, responds to that, drops the blood sugar, and they go through this yo-yo, and they keep going through this yo-yo over years, up and down blood sugar. Insulin resistance increases over time, and they end up diabetic, even though their diet has been wonderful. So there's a possibility for you. So we have a lot of underlying causes that we're trying to address when we're approaching someone's health holistically, as opposed to, or at least, let's not say as opposed to, that sounds like they're opposed, they're not. But it's an approach that is more holistic, more complete in my mind. Okay? And when it comes to chronic disorders, holistic measures actually get us a solution that gives us a healthier individual. So enough of that for now. This was a show about the whole person and all of the influences that affect our health and how we approach it holistically. And you've been listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And I'm Dr. Christopher Jackson, PhD DO in Florida, and my practice is by the same name, A Path to Wellness. We're in Northeast St. Petersburg, Florida, and you can take a look at our website if you'd like at www.aptw.net, short for A Path to Wellness. We'll talk to you next time.